Hello, my name is Jukyeong Kim, and on behalf of my team, I'm truly honored to present our study today. Current intervention trends and efficacy tendencies of rotator cuff strengthening and scapular stabilization exercises in patients with chronic subacromial pain syndrome. I will begin with the background and purpose. Subacromial pain syndrome, or SPS, is one of the most common musculoskeletal disorders causing shoulder pain. In clinical practice, both rotator cuff strengthening and scapular stabilization exercises are widely recommended. However, there is a significant lack of clear clinical consensus on which intervention is truly superior or what constitutes the most optimal program design. This makes it difficult for therapists to make evidence-based decisions. Therefore, the purpose of this narrative review was to analyze recent randomized control trials. We especially aim to provide clinical evidence for optimal physical therapy program configuration by systematically analyzing two key factors. First, the methodological quality of the studies using the PEDro scale, and second, the tendency of effects according to the intervention duration. Next, I will explain our subjects and methods. For our subjects, a total of 12 randomized controlled trials published between 2015 to 2025 were included in our final analysis. These studies were selected based on our established criteria and focused on applying RC or SS exercise interventions to patients diagnosed with SPS. For our methods, we searched major databases like PubMed, ScienceZone, and Google Scholar, and two independent assessors evaluated the methodological quality of each study using the PEDro scale. We then analyzed the components of the programs and the tendency of effects on pain and function, categorizing the findings by intervention, duration, and by the PEDro score. This is a figure of our research finding process. Now I will present the results. Our analysis yields three key findings. First, regarding duration, the mid-term intervention groups lasting 6 to 8 weeks showed the most consistent and distinct positive effects on both pain reduction and functional improvement. In contrast, long-term intervention like 12 weeks showed a tendency for the difference in effects to decrease. This is a table of these results. Second, regarding quality, this is our most significant findings. In the excellent quality group like PEDro 9, the results were split evenly 50-50 between superiority and no difference in the good quality group like scores 6 to 8. The highest proportion, 44%, also reported no difference. This critically shows that as study quality increases, the evidence for one exercise type being superior decreases. This is also a table of these results. Third, regarding current practice, we found the 83.3% of the included studies already use a combined intervention approach rather than choosing one over the other. Finally, our conclusion. Our review confirms that both rotator cuff strengthening and scapular stabilization exercises are effective treatments for patients with chronic SPS. However, the data provides two critical clinical implications. An intervention duration of 6 to 8 weeks appears to be the most critically efficient time frame. Second, and more importantly, the lack of a clear winner in high-quality studies suggests that the debate over which exercise type is better may be misplaced or irrelevant. The evidence strongly indicates that an individualized, integrated approach, one that focuses on the patient's specific functional deficits and neuromuscular control, is far more important than the exercise type itself. That concludes my presentation. Thank you for your attention.